So I'll be talking about immune-mediated epilepsies. I have nothing to disclose except that I would be discussing off-label usage of some immunotherapies. So what I would like to do is perhaps go over some basic background information about autoimmune or immune-mediated epilepsies, and then go over a few illustrative cases which I think would highlight or underscore the importance of this disease. So as you all know, patients with epilepsy, up to a third of them, there may not be identified a cause, i.e. they may not have a clear etiology. And currently, we are treating patients with either just prototype anti-seizure medication or epilepsy surgery or neuromodulation. So finding a disorder or an etiology that we can treat differently would open up a new avenue, and that's where the autoimmune epilepsy or immune-mediated epilepsy comes in. So immune-mediated epilepsy is a disorder where immunologically there is an immune response that would cause recurrent seizures, and seizures are not the only features. They may have other manifestations like cognitive decline, neuropsychiatric symptoms. So although the last decade or so there is an increased recognition of autoimmune epilepsy, the concept is not that new. Actually, people have tried, for example, giving steroid or immunomodulative therapy for refractory status epilepticus patients. And we are now recognizing neuronal antibodies in patients with epilepsy. In addition, infantile spasm, for example, responds to steroid or ACTH. Similarly, patients with fever, children with fever may have seizures, which may again underscore the possibility of immune response causing seizures in these patients. And lastly, patients with autoimmune disorders, pre-existing autoimmune disorders, may be at higher risk of seizures than the general population, which again may indicate some association as such. Now, the exact prevalence is not known, but it's estimated up to 6% of patients that present with late onset seizure may have immune-mediated mechanism. And those presenting with new onset refractory status epilepticus or NORS, a majority of them are actually unknown or cryptogenic, but up to a third of them may have actually underlying autoimmune mechanism. And not only new patients with epilepsy, but there have been some reports actually doing a study finding out how many % of epilepsy patients do have neuronal antibodies. And it's estimated up to 35% of patients may have pre-existing neuronal antibodies. This study actually by Dubai